Constant pain, whether it's in your back, your neck, or your joints, is not something you just have to put up with. Our next guest has a non-invasive technique which might bring you the relief that you're looking for. Dr. Jens Korgaard is the owner of Community Chiropractic in Newington and specializes in a gentle, energetic chiropractic form of pain relief, and he's joined by his patient, Betsy Correa. Thank you both for being here.
Thank you for having us.
Doctor, tell me how your technique is a little bit different than other chiropractors.
Yeah, it's, you know, most chiropractic techniques, focuses on moving bones.
There's cracking, right?
Yeah.
You can hear it.
Yeah, and what happened was while I was in chiropractic school, when I started chiropractic school, I was in a really bad car accident, and because I already had some scoliosis issues, I started having a lot of back pain, neck issues, and low back issues, and through my chiropractic college studies, I tried a lot of different techniques to try and get, better.
To get yourself better.
Yeah, but after 3 years, my back was even worse than when I started, and I was about to graduate school, and I could barely stand up some days, and I didn't even know how I could become a chiropractor.
Sure.
So a friend of mine had gone to one seminar in this technique called network chiropractic, and I saw him working on somebody, and it's very gentle touches. And when I saw him working on patients, I thought it kind of looks like voodoo,
Sure.
But at that point, my back, I was in so much spasm
You would
and pain.
probably give anything a shot,
Yeah,
right?
yeah. I had pretty much exhausted everything else, and nothing had helped. And so I was like, well, let's give it a shot. I was like, he needed guinea pigs to work on, and I was like, yeah,
Sure, I'll give it a shot.
try,
And
because
sure
I
enough.
knew, I could see it couldn't hurt me. And that was pretty much my criteria. And so after a month, my back felt the best it had in 3 years, pretty much. And I figured if he barely knew what he was doing, so I thought maybe if I found a chiropractor who had gone through the whole 3 years of training of this particular technique.
And now you're the expert on
Yeah,
it, right?
yeah.
You learned how to do it.
That's how I got into it, because I started seeing a chiropractor who had gone through all this training, and my back felt better and better. And what also happened was I had been on asthma and allergy and reflux medication. I had IBS since I was like 5, 6 years old. And after a few months in care, I realized I wasn't taking my medication anymore.
So it was actually fixing other problems, other ailments that you
And
had.
I wasn't even focused on that. I just wanted my neck and back, to feel better.
Added bonus, right?
Yeah, and then I realized I needed to learn this technique, and I've been doing it since 92.
And now you have been.
Yeah.
And Betsy, let me ask you, why did you see Dr. Korgaard?
My mom went first to see him, and I saw a marked improvement in her pains. And I said, why not give it a try?
Sure.
Since I too have tried different techniques and it wasn't working.
What was your
I
ahead.
had horrible neck pain. I've been HIV for 20 years, and I have diabetes for about 17 years. So with that comes chronic pain, fatigue, emotional stuff, and I figured I wanted to give something new a try. And the way he explains things, it makes it very clear that it will help both. Because he says there's physical subluxations and there's emotional subluxations, and when you are emotionally unstable or you don't feel well emotionally, you're not going to let go of a lot of the pain. Sure. And it manifests physically.
And why don't you break it down for us? You brought the instrument that you use.
Yes.
How does this all work?
Yeah, so this is actually another technique that I started using about 8 years ago, and I combined it with a network. And most chiropractors, we look at energy in the body, right? And that's kind of why I brought this spine here.
Yes, do show us.
So I don't know if this will show, but we have energy that runs through the spine, through the brain, down through the nervous system, goes out through all the nerves to our muscles and organs and everything. And when that works perfectly, we're in good health.
And you don't feel anything.
Yeah,
Everything's
usually
normal.
we feel good.
Okay.
And so what can happen is, where you see these red ones, is there can be some irritation on the nerve or tension in the spine. And so what I'm looking for is where is that tension, and how much is it in the nervous system, and then we release it.
Sure.
And I just use different techniques to do it.
And it's very gentle.
Yes.
There's no pushing, cracking, any of that.
It's very gentle. Now, not to say that the other type of chiropractic works for lots of people, and but this works for a lot of people who maybe they prefer something more gentle, or maybe that technique didn't work for them, like for me. This is just a different approach to it.
Okay.
So the network chiropractic is just very gentle touches that are in specific energetic places on the spine that helps to release that tension.
Okay.
Now the core and specific technique where I use this instrument, it's called an arthrostem.
Okay.
It does very gentle pulses. It doesn't send any electricity into the body. I'll show you. It just does a little vibration.
Oh, sure.
Yeah. So it's very gentle. So let's see if I can show you. So it's based on what's called, we work on energy and checking energy.
Yes.
So one of the ways is we use something called muscle testing.
Okay.
Where, let's say you put your arm up. Now I'll show you. You can put this arm up here, and I press down. It should be strong. And so, for example, if I find a place where there's an issue, it would go weak.
Okay.
Now, this approach, after a while, it can hurt. Your arm gets tired or different ways. I use a different method that's called the Korgaard technique, where we use different it's more like a place up around the spine where we can get.
Okay.
It's like neurofeedback, where you get feedback from the body. So I'm checking the body and then checking to see where those issues are.
And you can tell just by that gentle touch?
Yes, very gentle. And then what I would do is, if I find an issue, I would use this little instrument and I just use little taps on it, and then I go through the whole spine and check where those issues are. So it's very energetic based. Instead of we're trying to teach the body to do what it's supposed to do from the
Some sort of balance? Is that what you're trying to create?
We're trying to create balance in the body, remove these issues are called subluxations, misalignments in the body, or energetic blocks. So we're trying to remove those blocks so that energy can move through the nervous system and then go out to all the areas, the muscles, the organs. Where that's kind of why I've started noticing my digestion getting better, my asthma getting better, my allergies getting better, because when the nervous system functions better, the immune system functions better, and everything else.
Like a big domino effect.
Yeah.
Well, this is really interesting stuff, but I feel like we just hit the tip of the iceberg here.
Yeah.
We're out of time, but of course, if you want to contact Dr. Korgaard at the Community Chiropractic, it is located at 1268 Main Street, number 105 in Newington. Phone number is 860-667-4722, or you could visit him at communitychiropractic.com. Very good. Thank you so much for being here.